Hi, I'm Laura Earnshaw, the founder and CEO of myHappymind. I'm also on the board of the Mental Health Foundation and I'm a proud NHS England Fellow on the National Innovation Accelerator programme, a programme dedicated to helping innovations spread where they have proven impact against the NHS's priorities. Here at myHappymind, we are all about prevention, the prevention of mental health issues in children and young people. We all know that the crisis in children and young people's mental health is escalating at the rate of knots, and we truly believe that unless we're investing in prevention alongside reacting to these mental health issues, we'll never get out of this spiral. The Darzi report, which was commissioned in 2024, emphasised 3 key shifts that are required to transform the mental health of our young people, from hospital to community, from analogue to digital, and from treatment to prevention. And our work aligns with all 3 of these shifts. We provide innovative, digital, science-backed programmes in early year settings, in primary schools, and in secondary schools that support children from age 3 to 18 to develop positive, science-backed habits that help them to build resilience, self-regulation, and self-esteem. Of course, all of these are proven in the science to be prevention-based factors. When it comes to mental health, we believe that every single child should be receiving a preventative mental health education. But the reality is that in most schools, it's only those children who are struggling or at the point of need that receive support. And we're on a mission to change this. myHappymind is delivered digitally to children, to staff, and to parents via an app. This systemic approach is absolutely critical to our success because to impact the child, particularly when we're working with the younger children, it's really important that we also support the staff and support parents with their well-being as well. That's why our programme is for children, for staff and for parents. And we think this is why we have the impact that we do. We do our own extensive impact reporting, working alongside the 2,000 plus schools that we work with in the UK and internationally. But we've also done lots of impact work with external bodies to validate myHappymind's impact. This is included in some of the documents that you'll see just below this video. For example, a University of Chester real-world validation study has proven that myHappymind is effective in reducing mental health issues, in supporting the building of resilience and self-esteem. We've also done studies with the NHS that report significant impact across both health and education priorities. In one such study in the year just before the pandemic hit, we were able to evidence a 43% reduction in CAMHS referrals across 25 primary schools as a result of implementing myHappymind. Those same schools saw reductions in referrals into the SENCO within the school of over 67%, and reductions in things like exclusions and absenteeism. And the narrative behind all of that data is actually really simple, and it's that myHappymind enables schools to become effective early help and preventative services and nip issues in the bud that might otherwise escalate to needing more specialist support. So why myHappymind as part of your mental health strategy? Well, not only do we take pressure off your specialist workforce because it's the teachers in schools that deliver the programme, but we're also reducing the number of referrals that go into your specialist services so that you can deal with those cases that matter the most and reach those children faster that need the most support. Alongside that, our model means that we're upskilling an entire new workforce within schools, and we're supporting parents, something that across the nation we know is a real priority. Now, we get funded in lots of different ways, including at place level, by mental health support teams, and also by public health and local authorities. So if you're looking for an innovative way to really take mental health prevention seriously so that you can reduce those CAMHS referrals and reduce the pressure on your services and do what's right for children and young people, then I would love to tell you more. We're a digital solution, which means we're highly scalable, we're contributing to the net zero agenda, we're affecting positively so many different health inequalities, and so much more. I'd love to have the opportunity to talk with you and tell you more about our impact. Just click the button below to arrange a call. Take care and bye for now.